One of the things that's interesting is that Brownstone deals a lot with the topic of infectious disease and public health, and yet its founder knows nothing about those subjects. Well, I know something about it. Actually, oddly, I've been writing about pandemic planning since 2005. Since 2005, when I first saw that there was these crazy people that believed you could just lock down the world and make a germ go away. I didn't use all my time this morning, just now, so just a quick story. Right? But this is true. In about a month into lockdowns, I had written already, probably a dozen articles just screaming about this kind of stuff, and the phone rings. And a guy says, "Hi, this is Rajiv Venkaya." You know that name? Does anybody know that name, Rajiv Venkaya? Yeah. So he's the guy who invented pandemic planning, invented lockdowns. And he had a desk job at the White House in 2006 when the president came running into him and said, "Oh, there's going to be a pandemic. It's the bird flu pandemic. What should we do?" And so he's the guy who set all this stuff in motion. And he called up his friend at Sandia National Laboratory, who asked his daughter, and she said, "Well, I'm afraid of cooties too." And so she invented social distancing. She was 14. But anyway, so he's on the phone with me. He used to work for the Gates Foundation, head of viruses. Yeah, this guy's one of those guys, right? And he said, "You really, really need to stop writing this way. It's very bad." I said, "What do you mean?" He said, "Well, you just stop criticizing lockdowns. Lockdowns that's the way we do things now. And you're just wrong. You're on the wrong side of history." And I said to him, "Well, that's not likely, but I do have a question for you, and I keep wondering about this because I can't figure it out. Let's say we lock down for a long time, we all social distance, and we live in refrigerator boxes or whatever your plan is. What happens to the virus?" He said, "What do you mean?" I said, "Where does it go? I mean, does it just go away, or what's your plan?" He said, "Well, we bring the R naught down, and then the virus, and then it goes away." I said, that's not true. The R naught is a measure of what's already happened. You're mixing up cause and effect. You know this. So what you just said is untrue, and you know this. So what's your real plan?" He said, "Well, truth is, we've got a vaccine on the way." And I just laughed. I said, "Oh, you've got a potion to inoculate the whole population against the coronavirus, huh? An infinitely mutating respiratory virus with a zoonotic reservoir? And you got a vaccine for this thing? Give me a break." Anyway, the conversation went on 30 minutes. I hung up the phone. Yeah, that's just one of the many stories. In the course of which, we linked up with the FLCCC, which is an organization born very much like Brownstone out of an emergency. These doctors, Dr. Marik, who's the founder, Dr. Cole is a very important figure. Both of them have been great heroes. One of the strangest features of the last 3.5 years is that it was all done in the name of public health. Can you believe it? Public health's never been more catastrophically bad as a consequence of all this stuff. So the FLCC flew into a massive resistance mode. They came up with the protocols to actually deal with SARS-CoV-2 rather than just delay it and delay it and delay it and keep you from taking ivermectin and so on. For the whole length of the past. Anyway, FLCCC and Brownstone have grown together. So we've partnered up, which relieves me from the burden of being an expert on this subject, which is why these guys are here. And then David Bell, who heads up our, so here's Dr. Marik, Dr. Cole, Dr. Bell heads up our pandemic planning. This is a new group that is policing the World Health Organization and all of its infinite outposts, public.
Right, so, whoops, what happened?
Uh-oh. We dead? Oh, there we are. Okay. So, why don't I have all of you make a quick opening statement about, let's just broaden it out to the state of public health and what you're thinking. Dr. Cole, why don't I start with you?
Well, I'll start with
accidental Freudian slip from, you were at a conference with me a couple weeks ago in upstate Western New York, and the hostess, Shannon, we were having a evening imbibing. Oh, there, okay, I'm on. And slip of the tongue, where we are with public health is we're suffering from wealth and hellness, not health and wellness. And that's where we find ourselves, in an era where everything is money driven. And follow the money. Look at the whole story of these last 3 years. Yes, are there different puppeteers and whatnot? Sure. Can you point the fingers at this agency, that agency? Absolutely. But it's wealth and hellness instead of health and wellness. Public health is broken. That's my initial statement as to where we stand right now.
So, Pierre and I often say the world's gone mad, and it truly has gone mad. Everything is turned completely upside down. And so while we want to be optimistic for the future, unfortunately, I think recent circumstances are such that there's a lot to be scared of. I think the implications of this massive vaccination, well, sorry, it's not a vaccine. We should stop calling it a vaccine. It's genetic therapy. I think the fallout from this, billions of people who have been injected with a genetic material is going to be really serious, and both directly and indirectly. And I think, you know, we're still in for a rough time. You know, I think COVID was bad, but I think the response, as we all know, was amplified the problem enormously. And there's no question of doubt, they're not safe, they're not effective. The fact that we're still vaccinating children, we're vaccinating pregnant women, is a moral and ethical outrage. And the fact that people just keep quiet and don't object is preposterous. And so I think we get it. The problem is we are projecting to those who get it. It's the people that don't get it that we need to change their mind, and they need to see the truth. Because ultimately the truth will prevail. You know, you can't hide the truth. It will come out. But unfortunately, I think the damage that will have been done will be immeasurable.
And David, just a couple of remarks. You were trained in traditional public health, and these have been startling times for you.
Yeah, so, I mean, I think we've abandoned public health. We're not following public health. So, lifespans increase because of better sanitation, better living conditions, better nutrition, etc. We're all being told it's because we're injected with vaccines, etc. They came very late. The WHO defines health as including mental, social well-being, so it's completely illogical. It's not public health to concentrate on a virus and not concentrate on the other two. It's the opposite of public health. Mass vaccinating the world when half the world is sort of under 25 years of age and they're already immune to a virus, and diverting all those funds when you know that poverty is the main cause of reduced life expectancies globally is not public health. So we're following something completely different, and I think, as you said, that's because of money. It's public health was once run by people trained in public health. It's now run essentially by people who are trained in software and who are very wealthy and see it as a way of increasing their wealth further, and that's sort of corrupted the whole system. So it's not public health now, it's something completely different. It's a for-profit industry, and public hospital.
Well, this to me raises a very interesting question concerning lost knowledge. I don't entirely, I wonder if you have any theories about this. There's certain things we used to know for sure that seem to be gone. Natural immunity among many other things.
Well, like Fauci said in 2018 concerning influenza, natural infection is the mother of all vaccines, And so to lose common sense, I joke that common sense is no longer common, which we all know, but common science is no longer common. And just the basic construct of vitamin D. We live indoors, we work indoors. We're immune suppressed. Anybody right now in the northern hemisphere not taking vitamin D right now is immune suppressed. And vitamin K2, don't forget that. We've lost the basics of medicine, and physicians become automatons in a big system that is a leviathan that it's hard to overcome. And to your point, that country doctor with the black bag just knows each individual family member, each individual patient. We've lost that connection to humanity. We've lost our humanity in this process. So not only the knowledge loss, but it's more a loss of soul. And when you can just plug and place one physician into this system, okay, we need one for this position to do that, you become no more than a commodity and a bus driver, which is horrible to, we want to stay optimistic, right? Right, we do, yes. The oath is between a physician and a patient. Primum non nocere. First do no harm, but that's physical harm, that's psychological harm, that's financial harm. And that's an oath between, it's an honor, it's a code, it's a covenant. And that's what we need to get back to, in addition to the basic science and the basic knowledge principles. But you don't get there until you change the culture of medicine. The culture of medicine has become commoditized with too many middlemen in the insurance industries and too many vendors and too many big companies. What we really need to, we need to get away from big, if you take the P off pharma, it's harma. And I think we need to remember that. I mean, so I'll shut up and let Paul comment.
You're welcome to jump in. You don't have to wait for me to ask the question.
So, as David said, public health doesn't exist. It's an illusion. And really, there are some really significant things that public health agencies could do to improve the public health, which is what their goal should be. And we know pharma suppresses symptoms. Pharma doesn't treat disease. We know that lifestyle changes, and I'm an intensivist, and now I'm talking about diet, I'm talking about sleep, I'm talking about sunshine, I'm talking about relaxation. These are the things that keep people healthy, and these are the things we should be talking about. If our damned healthcare agencies had said, everybody take vitamin D, and we agree with this. Vitamin D, it may sound like a miracle, but if we had, and everyone in this room should be taking vitamin D, there's no question that it would significantly have impacted the course of this disease. This is a simple public health measure, but they weren't interested because there's no patent. That's what it's all about. It's about making money and a patent. If you could patent the sun, pharmaceutical companies would patent the sun. And that's the problem. If there's no money to be made in it, they're not interested in promoting health. And there are really simple things you could do. Example, cancer. We maybe talk about it. Cancer is going to become the most important disease on this planet. It's going to overtake coronary artery disease. And there are simple measures that people can take to reduce their risk of cancer by 40%. And this is proven by randomized, controlled clinical trials. But no one talks about it because cancer is big money. And so, you know, we don't have public health in this country. I don't know if we have it in the world, but that's what our goal should be, is to help people promote their own health. They need to be empowered to take control, because the healthcare agencies certainly aren't going to do that.
And I think it comes back a bit to common sense. So we're being told, you know, we need to postpone cancer treatment and so on because we have this existential risk of pandemics that's increasing, etc. And we had, you know, the Spanish flu, people know about 1918-19. We didn't have antibiotics and most people died, as Fauci has written a paper on, from secondary bacterial infections. Now we have antibiotics. That won't happen anymore. Right. There was a flu outbreak in the 1950s, one in the 1960s. Right. And that's it. Right. And so in a century, we had 2 significant flu outbreaks. You know, swine flu killed less than the normal flu. If you look at the Ebola, you know, SARS-1 killed 800 people. That's a third of the children that die every day of malaria in the whole world, you know. So we haven't had any big pandemic for over a century. And we don't expect to, because our medical care has improved in the last century. We have antibiotics. We should be healthier. I mean, we should be eating better. Yeah. So it's the whole thing is illogical. We've just turned the world upside down.
Could I just add something about the 1918 pandemic, which people may not know? There was an effective treatment for influenza pneumonia. Yeah, masks are placed on the rectum as a... So this was done in Massachusetts. It was written up by the Attorney General. And what they did is they took the hospital bed from inside to outside. They put these people in the sunshine. Yeah. That's what they did, the sunshine. The sun is there to cure. We should all be exposed to sun. And the mortality fell from 43% to 12% just by taking people into the sun. And so, you know, we forget that the sun is there for a really good reason, has curative powers. And most of us spend our days indoors. We don't get ultraviolet light, we don't get infrared light. We have these lights that are, you know, LED lights. So we've lost our touch with nature and the way we were meant to be. Just an interesting thought.
And in COVID, we locked people in a room if they were positive.
Yes.
It's the opposite, and we're pretending we're evolving species. I mean, we're not. We're going back.
Yeah, it's... Wow, just a few questions. The big question I have, which I don't think maybe somebody has an answer for. I don't understand how every hospital in the whole country in like one day got locked down to everybody but COVID patients and emergency care. But otherwise, all diagnostics were gone, and all elective surgeries were gone. Does anybody know how or why that happened?
Because we have legislators that write bad laws. And if you, I'm not going to connect all the dots in 1 minute, but if you look at how our system has allowed this to stack on top of that, on top of that, on top of that, to accumulate the power into just 1 or 2 individuals to make very bad decisions, that's happened. And so one dictator, one just very uneducated scientist or pretend scientist can say, I am the science, and all of a sudden people do that. And I'm not saying it's Fauci, you know, Becerra and Birx and others. That's the problem, is we're looking upward for the solution instead of looking inward for the solution. And so to be able to shut everything down like that and cancel everything instantly was insanity. There was no logic, no reason, no science. This wasn't Ebola. Most of us that have immunology, virology, pathology backgrounds knew right away, wait, this is a coronavirus. So there was something at play well beyond the coronavirus.
They wanted to create fear.
Yeah, well, fear was the
That's
biggest
what they
pandemic.
wanted to do. They wanted to scare the shit out of everybody, so they were shit scared and they would follow their narrative.
And fear-
That's what they wanted to do.
And-
is it was based on fear, and they were really very successful in doing this.
And what's fear?
People did the most ridiculous things. They wore masks. They locked themselves indoors. I mean, kids' playgrounds were closed down. It was all based on fear. And
you're saying that was a deliberate, there was an effort to create that fear?
I think this was by design.
Yeah.
They wanted to scare people with the intent. The only answer to this problem is the vaccine. This is going to save us. And I think that was planned. I think it was indoctrination. It was mind-bending activities to make people scared. And people are still scared. I mean,
fear is very simple. False expectations as real. And you just throw those things in front of people and like, oh no. And I mean, and look in retrospect, here we are, bad flu season at best, was the worst pandemic ever. No, it wasn't, absolutely not. And yet we still hear the mantra, and I'm sitting on a plane with a lovely 80-year-old couple a week ago, both masked, and I'm so sorry I'm lowering my mask, and please take them off. And we still have these remnants within society, and trying to expunge this fear is, I think, critical. And giving people optimism and hope, I think, is critically important in healthcare and public health, in messaging, in empowering people to say, look, the best doctor you will ever meet is here right now. And I don't mean that with arrogance or hubris, because it's you. Look in the mirror. You're the best doctor you will ever have. And if we empower the people with knowledge to take care of their own bodies, that's how we change health. Public health is getting the individual caring about who they are and how they are.
So I think Ryan's right that the way to overcome fear is to empower people with knowledge. So they can understand that this is all BS, and they can empower themselves. They are in control. They have control in what they can do.
Well, I hope we can figure out precisely what happened. It's really bizarre. At the Supper Club the other day, we had a guy who was in charge of delivering ventilators. It's his business. He delivers ventilators and diagnostic equipment to New York hospitals. And he said, I can tell you, during those strange, dark times in the early part of, in the middle of March, right when the lockdowns happened, he said the hospitals all over New York, but for two, were complete ghost towns. They were empty, because people were afraid to go to them. And the whole canard about the freezer trucks, because when Fauci's interviewed now, every once in a while somebody will ask him about lockdowns, and he'll say, well, we had to lock down because look, there were freezer trucks with bodies in them. Well, that happened after. That's not correct. That happened after the lockdowns, and the reason was that the coroner's offices were all closed. And so were the funeral homes, and everybody was afraid to touch the bodies, and they didn't have anything to do with the bodies, so they drove out freezer trucks and hurled a very, at least according to my friend, a very normal amount of death that you would have in a regular day in freezer trucks. And then the news media shows up and says, freezer trucks in New York, it's a terrible pandemic happening. So it's so spooky when you deconstruct these details. It's all just weird.
The important thing, Jeffrey, is when you put clowns in charge, you get a circus.
But it wasn't just the people in charge, so the medical profession went along with this.
I know, they were
That's the
clowns
interesting
too.
thing for me.
At least we gave them the makeup.
I mean, the fear for the general public affected the medical profession the same way. We forget, they're just as susceptible to fear and to... So the clowns in charge could only do this with compliance of almost everyone from the bottom. And, there are hospice nurses who would not let families see their dying relative in case they infected the dying relative with COVID and ridiculous things like this. That this happened over and over again all over the place. In intensive cares, neonatal, the parents couldn't be with the child. So these are the same staff who a year earlier would have been, paragons of sort of virtue in helping the families with the dying, and everyone would have raved about what wonderful people they were, and people just completely flipped in the health field.
Well, and also, you remember those days, the news media was filled with death announcements. Oh, today, today another 50 people have COVID in your community, and another 3 people are dead, and here are their names. And it was every single day in the headlines was just death and sickness and death and sickness. And now, here we are, as far as I read the data, we're in a period of unprecedented excess deaths going on right now, and it's all vanished.
Doesn't matter, you can't fund it.
Yeah, the statistics are astounding when you look at it, and I commend my friend Ed Dowd and what he's done with some of the data sets that have been pretty much hidden, and to roll out an experimental gene-based injection on humanity and then ignore the signals is unfathomable. And as Dr. Malone points out many times, and great friend, this is a psychological operation. It's the 5th generation warfare. It's look here, BLM, look here, rainbows, look here, Ukraine, look here, climate, look here. But they don't want you to see what's really happening. And I think, obviously we're talking about medicine, but it's all the Venn diagrams overlapping and just trying to figure out how to message. I think that's the important thing that Brownstone does. It's obviously a very intellectually strong institute, and getting that message out to people to think for yourself. Because we need to overcome each of these obstacles. There is still the fear. There, as David points out, even in a noble profession, people drink the Kool-Aid.
Yeah.
How do we un-Jim Jones those people?
What do we do about the medical profession going forward? I'm sorry, these are huge questions, and I want to take 2 minutes on this and go to question and answers. By the way, do we have a microphone for the
clock?
For questions? I wonder, Janet, do we have, where's Janet? She's not around. I don't know how we're going to do the questions. Maybe we just have to stand up. But yeah, could you just give me a quick, each of you, just explain what, let's say we have sincere legislators, and we want to fix up the medical profession. What would we do, or is that even a hope? If it's not a hope, what are we going to do in the meantime?
So what we've done is we've had conversation with many legislators, and basically what we need to restore is the patient-physician relationship, is that the government, the health agencies have no place, the FDA, the CDC, in directing how patients and physicians interact, and that sacred Hippocratic relationship. That has been eroded, and that's what we need to restore, is the government, the health agencies have no place in interceding in the sacred relationship, which is what medicine is based on. It's a relationship between the patient and the physician. There's something called informed consent, which we've forgotten about. You have a discussion, and the patient agrees to the therapy that the physician is suggesting, and that has been eroded. We've lost the patient-physician relationship, and pharmacies, healthcare agencies have no place in interfering in that sacred relationship.
And that's legally, that we seem to be making progress on the legal front, right? That law went down in California.
AB 2098.
Yeah. Some good aspects, but still, a lot of injury has been done to the freedom of doctors to prescribe, and many doctors are facing terrible persecution from medical boards.
Yeah, I mean, and this is where it takes everybody to get involved, one by one. I think we suffer from safety and comfortism in many parts of the world, and to stand up, think globally, act locally, but act at that local level. So I got involved. I got voted onto my Central District Health Board, wherever you see something wrong, do the Gandhi thing and be the solution. Be the solution that you want to see, be the change you want to see. So I think where we start is locally. Local, that organic grassroots level. Wherever you are, change your community, change your local culture. And that's how it grows. We're under horrible attacks because we've allowed this regulatory monster to grow over all these years. We do need to change those things, and that's a stepwise process, and it's taking it apart brick by brick and rebuilding it. It's no easy task, and I think the critical thing, and I'll credit Dr. McCullough for this one, is be relentless. Whatever you do, be relentless, and silence is compliance. So be involved.
Yeah. Dave, did you have any comments about this?
Well, I agree that local thing is most important. I think at the top end we've got to undo conflict of interest somehow. And, you cannot, if you're connected with the FDA, you cannot be taking money from the private sector within 5 or 10 years, etc. If you're WHO cannot take money from private interest full stop, even if they need the money. And we've got to just regain the realization that private is there for profit, not for the public good. And they're two different things.
Yeah, it's all gotten mixed up, hasn't it? It's just a tremendous mess. That's been a real education for me over the last. Well, listen, we have we have about 13 minutes. What if we should do some Q&A? Go ahead.
I'll let Brian use the word they. Who is they?
Who's they? Yeah. Nobody knows?
T-H-E-Y. They hover everywhere yet. That's a hard question. Who are the they? And again, it's a collusion and a cabal of the corrupted. I don't know. And no one of us is as dumb as all of us. And so I think these circles of greed that just feed on each other. Oh, they're doing that. Okay, we'll do that. Okay, oh, they're doing that. Okay, oh, hey, here's an opportunity. And then we willy-nilly do pass laws that compound on each other. And then when you go back and look at the code of federal regulations and look what Congress did to change pandemic planning, et cetera, time and time again, it's a compounding problem. So, and then here's the problem: the accountability never comes. Go back to the thalidomide crisis, no accountability. Go back to the Vioxx crisis, and all those tragically killed with a horrible drug there, no accountability. So I don't know who they are, and everybody, has it's this group, it's that group, and there's puppets above this and governments behind that. I don't know, but I think we all see that it's happening, and I think there are better dot connectors in some of those realms outside my expertise. I don't know.
One of the terrible things we've discovered at Brownstone, you probably know this, but and it was Debbie Lehman who first identified this to me, was that the rulemaking authority during the pandemic response was not the CDC or the NIH, it was the FEMA, Department of Homeland Security, and the National Security Council. That was very clearly stated in the Great Edict of March 13th, and then it mutated. So this is one of the reasons we're having such a hard time getting information, because it's all classified. Isn't it crazy?
It's very simple. I mean, how do you define an elephant? It's a mouse built to government standards. And so, and how do you eat an elephant one bite at a time? And so it's tearing that elephant down back to making it a mouse again. And so they are too many layers of too many rules, too many laws, too many regs over too much time.
Tom, Mark's.
Yeah, Jeffrey, a couple days ago you wrote an article where you defined the strategy that you think was lockdown and vaccinate.
Yeah.
Singular. And I'd love to hear what the panel actually had to say. You can explain.
This is in response to Joe Nociada's article in New York Magazine. Did you read it a couple of days ago? The article is saying that the lockdowns failed, and their new book called The Big Fail. It's actually the first, in 3.5 years, the first breakout we've had into the mainstream. The first one. And I was thrilled by the article, but Janet, you can bring that up here. We should make people walk up and do a little public thing before their extremely short questions. But the article said, at the end, they said, well, not everything was a failure. Of course, Operation Warp Speed was a tremendous success. And I call this the exogenous theory of the vaccine, which I've learned is not right. It's wrong. You never could have gotten this thing approved, absent the emergency powers and the panic and the fear and the thing and the bad health and the extra 20 pounds and the drunkenness and the pot pandemic and all the rest and the ill education and, oh, God, what a disaster. And they're like, oh, please give us a shot. So yeah, it's all connected, right? So and according to Jay Bhattacharya, this is the new White House plan for the next time is lockdown then vaccinate, lockdown and vaccinate. So it's just like out of the movies. You know, have you ever seen the movie called Contagion? Yeah, so terrible disease that's both widespread and killing everybody, which is basically impossible, absent an 8-week period of latency, but that would never happen. But in the movie, there's the great inoculation that comes along and saves everybody, right? So this is what they're trying to reenact, this fantasy. It's
predictive programming.
Yeah.
And now if you come up to the microphone, make sure you stand 6 feet apart.
Yes,
just saying.
Yeah. All you disease vectors, let's see how this goes. Let's see how it goes.
I guess it's the test dummy.
Yeah, you should, I don't know, can it lift up? And
I can speak loud.
Yeah, or something, yeah. Check. Yeah.
Okay.
It's good.
Okay, so I guess one of my questions you alluded to a little bit, and my name is Robin Tyner. I have a background in science, oceanography, 32 years active duty, and but on the medical side of things, there's people that I know that saw right through the COVID, didn't get a shot, all of that type of stuff, and then, ones that surprise you. But the people that saw that then come to other things, cancer, he's one for main thing. Oh my God, you got to do what the doctor says and they're going to save your life. And then you question that at all and you're crazy. And there's a standard of care thing that then, well, you go get another opinion and you find out that everybody's got the same opinion because they have to you look at the checklist and you see X, so you diagnose, diagnosis X equals give them Y with no individual thought. And I'm just wondering how you think what has happened just with the shots is parlays on to all these other diseases in society.
A groupthink problem, but
It is. It's absolutely a groupthink. And very briefly, again, no one of us is as dumb as all of us. It's guidelines destroying medicine. A guideline is a guideline, but it doesn't make you an individual. And that loss of individuality, that loss, like David said, of informed consent, and you're not an algorithm, and you are not a recipe, and a baker goes in and makes a lovely cake. Great, but you are not a cake. You are a more complex organism than a cake. So doctors following algorithms, then we turn all medicine over to AI and lose the human touch. And this is what we're up against. You point out a very obvious problem, and it's that ability to think freely and want to have what you want for you, not what a system wants for you. We could talk for an hour on that. You bring up so many great points.
It's really the first time in recent medicine that there's one way of doing things. This is the narrative, and you will not deviate. And if you deviate, you're a conspiracy theorist, and you will lose your job. And they've been very successful in establishing this is the only way. There's no alternative. That they've censored any discussion. There's no discussion. We can't have a conversation. We may not always agree, but at least we have a discussion.
Yes.
We've created this environment that this is the only way. If you go to hospital, you get remdesivir. Even though remdesivir will kill your kidney and kill you, you get it, and there's no alternative. They've created this monstrous situation.
The death of dialogue is the death of the patient.
That there's no dialogue, there's no discussion. This is what they, whoever the they is, want to be done. And it's terrible for patients because it's this way or the highway. Obviously, there are people here who actually understand that there are alternatives.
My name is Neil Berkowitz. I'm a family physician in San Diego for the last 40 years, and I have my own practice. Have not worn a mask for one day in my practice, have not been vaccinated. But I just want to address the question of what they is. The they is us. We've allowed ourselves for this to happen. It's not a they, because you're not going to get an answer to the they. It is us who have given up our liberties and allowed all this to happen to us. So I don't think the question should be who is they is. We should be looking at ourselves.
That's a great comment. Thank you for that.
You know, you were talking about the Mateus Desmet thesis, which I think is just such a great book on group psychology. An elaboration on Freud, I might add. But it's surely a combination, right? Bad actors manipulating fearful people, something like that.
I was going to say the same thing, because I think it is us very much. And in the medical profession, it is doctors who gave that remdesivir. And as those doctors knew it is harmful to the kidneys. They gave it to people with failing kidney function.
Well, they're still dishing out Paxlovid like it's candy.
Well, I always quote Twain, the man who does not read has no advantage over the man who cannot read. And so we get into this conversation in this group thing, but people aren't willing to look at the data, and they aren't willing to actually read the paper. And you know, the abstract says this, and the conclusion gives the genuflection to the genetic shot. But you go in the data sets, and they have nothing to do with what the papers and conclusions are. You're like, wait a minute, read. And if doctors would actually, you know, how do you hide a $200 bill from a surgeon? You put it in a textbook. This is the problem: is the hubris of knowledge is really damaging. And so I think we get into these discussions in silos sometimes, but if we don't have the dialogue that Paul points out, how do we improve things? And David's absolutely right. I think. Yeah, go ahead. There we are.
Hello, Chris Baker. I have a podcast called Fountainhead Forum. Considering missed mammograms, missed colonoscopies, missed cancer screenings, how many preventable cancer deaths are going to result from these idiotic, sadistic, and violent policies?
Unfortunately, the data sets are coming out. Ed Dowd about 2 weeks ago, if you go to financetechnologies.com with a PH, just put out the data set from the deaths, and people say, oh, you know, this uptick in cancer that we're seeing that I pointed out years ago. We're going to see this continuing. I was here in Texas last week talking to one of the busiest oncologists in the state. At first he saw clotting, then he saw leukemias, now he's seeing the solid tumors. And the powers that be will tell you, oh, it's because we had all the missed screenings during the early part of the pandemic. But if you look at the UK data from age 15 to 44, go to Ed's website, age 15 to 44, that's a group that you don't screen, because that's a group generally where you don't see cancers. Look at those graphs, 10 years running, and all of a sudden 2021, 2022. It is off the charts, deaths per 100,000 in those age groups. Same thing in the private German insurance company data sets in the pediatric population. The data is being hidden. I mean, the data is there. Our Health and Human Services owes us this. I know Senator Johnson has tried to get them through FOIA requests and through many demand letters, and Becerra's sitting on it doing nothing. The data is there. You can look at the vaccination rates. You can look at the cancer rates. This was a genetic modulation that we injected into a lot of people. A lot of people are fine. That's the good news. A lot of people essentially got a dud. I want people to be scared, but I want people to be rational. If something doesn't seem right, make sure you get checked. financetechnologies.com.
You know, it's infuriating because I'm sorry, but very early on, I think it was Martin Kuhldorff told me, as a result of all the misdiagnosis, that we're going to see a cancer epidemic. He said this in like July of 2020, and we knew, everybody knew this was coming. It's just ghastly.
Well, we screen for cancer to reduce it. So
Yeah.
if you stop screening, it'll go up.
Yeah.
It's complicated, yeah.
Yeah. Okay, go.
Thank you all for a great panel. My name is Lauren Pear. I wanted to talk about a comment that Dr. Marik made that I thought was really important. We can all talk to each other. We already all agree. I was wondering if you all have found any strategies of talking to people that don't agree and opening their mind. And if you're familiar with the book, How to Have Impossible Conversations by Peter Boghossian, and if you think those tactics might be effective.
That's a great recommendation. So if you didn't hear her, How to Have Impossible Conversations, good read.
Yeah, our reach has been, as I say, we're reaching 1 million people a month, so it's something. I think about this all the time. It's like, what's the best way to make sure that there's no change is to do nothing. So, we're doing, something, but we could definitely expand. Get further.
I think you start the conversation slowly. You don't want to overwhelm them with all the data because it's overwhelming. So you have to nibble at them slowly to try and, open their eyes because they're completely blind. And if you see the big picture, it's overwhelming. So I think you have to nibble at little pieces.
And it's very simple. I mean, nobody cares how much you know until they know how much you care. So you have to start with that love, that kindness, that friendship, that comfort, a little bit of humor, and then get into the uncomfortable things. And then, talk about politics and religion at Thanksgiving dinner,
I think we're going to need a book of epigrams by Ryan. So we're going to take a 10-minute break and be back and talk about the other good news concerning the utter corruption of journalism. My apologies. 10 minutes.